Hi, I'm Professor Dr. Faraz Farishta. Today I'm going to talk about the myths and facts about insulin. Diabetes and insulin. I think in last 16 years of my practice, I have heard many patients come to me and talk about insulin. Let me first tell you the fact about insulin. It's more than 100 years now that insulin has been discovered. So that just tells you the amount of authority what it has. It has sustained 100 years. So any drug or anything which sustains for more than 100 years itself speaks volumes about the safety of it. So whenever your doctor tells you about insulin therapy, do not get astonished. I think insulin is one of the very good drug which mankind has ever discovered. It has saved so many lives. For type 1 diabetic patients, it is like Amrit. Without insulin, they cannot survive. So, insulin is such a necessary hormone which is very important. It is an anabolic hormone. So, for all your diabetic patients, for type 1 diabetic patients, it is mandatory that they should take insulin as prescribed by doctors. In type 2 diabetes, there will be some conditions where certain times your doctors advises you to take insulin therapy. Most of the time it is either if it is pregnancy with diabetes or any acute conditions, any critical conditions where insulin is the drug of choice. Certain times if you are on 2 or 3 oral hypoglycemic agents, so that is like your drugs which control sugars, still you're not getting controlled, your doctor starts you on an insulin therapy. So I think a few indications, I'm just naming it, whatever it may be, when your doctor tells you about insulin therapy, do not get fear of it. So there was a study which was done which said that most of the time the prick is where people are afraid. And so what I want to tell you, we have moved way ahead in the last 100 years. The prick of insulin now is very minimal, so it is less than an ant bite. Believe me, we have such a beautiful thin needles which have come up with less than of gauges, which are very fine, so there won't be any pain. Most of the times when I tell my patient to take the first insulin in front of me, they are amazed. Then when we give them the first shot and then they say ho gaya, and then said ha ho gaya, then that fear is gone. So believe me, first I think is the prick, second is the social stigma. So still people believe that if you tell anybody that you are on insulin, it is a social stigma, but believe me, there's nothing to hide off. Third is the timing of insulin therapy. People were always afraid that if I had to take an insulin, if I have to go back, say maybe 20 years before, 15 years, whenever patient has to use an insulin therapy, doctors used to advise them to take the food, have insulin, give a gap of 20 minutes, and then take the food. Now, I think in the last decade, that problem is solved. We have the new generation insulins, which are so beautiful, which acts for more than 24 hours. We give them one shot of insulin, it takes care of sugars for the next 24 hours. The last is the fear of hypoglycemia. Matlab, when fear of sugar going down, so patients have this fear that if I take insulin, my sugars will go down. This will happen, that will happen. Believe me, the newer generation insulin, what we call as the basal insulins, the long-acting insulins, give you such a beautiful profile. You can take it 3 hours before or 3 hours after. Say today, you have taken the insulin at 9 o'clock in the evening. Tomorrow, either you can take at 6 o'clock or you can take at 12 o'clock at midnight. So that is the beauty of new generation insulins. So whenever you take this, you can take it even after food. So suppose you are going for a party. Now with the festival season around Ramzan and Ugadi, I think all of us are in that festive mood. So if you're going around, going for a dinner party, you can have your dinner, come back at home, and then take the insulin. So that it is such a beauty of that long-acting insulins that it has become very easy for you to take it even after food. The last is the weight gain. So believe me, again, these new generation insulins hardly cause any weight gain. There is some minimal amount of weight gain with all the insulins, very less with these basal insulins. But most of the time, we give basal insulins with other drugs like metformin or certain times the other SGLT2 inhibitors, where it doesn't lead to any weight gain. So I would say if your doctor prescribes you insulin therapy, do not get afraid of it. Say, yes, doctor, I'm ready to take it. I know the advantages of it. Please teach me how to take it. And then I would like to just brief on the technique of insulin. So before we used to have the long needles. So that is why we used to say you take the skin fold. In your hand, so you have to take the skin fold and then give it perpendicularly. But now, believe me, the needles are very, very thin. The size is thin. So you can just give it perpendicularly. So there are sides. So there are 6 sides where you can give. So these on the outer side of your arm, you can give it on both the sides. So these are two. You keep 3 fingers across beside your navel on each side, and after the third finger, you can give it on the both sides. So that is 4 sides, and then you can give it on the inner side of the thigh. So these are the 6 common areas. We have more, but these are the 6 common and easy approachable areas where people can take insulin by themselves, because nowadays we have insulin which comes in simple and a beautiful pens device, which can be carried across wherever you're going. There's no problem in it. And whenever you want to take it, just take out the pen and take the insulin. So don't be afraid of insulin. With the festival season around, if your doctor prescribes you on insulin, I think that is the best drug. Do not get worried. Just go ahead and take the insulin therapy. I hope some myths and facts which I have shared will definitely help all of you patients and to general public around. So do log in for the next episode, which is going to come next week. Till then, best wishes for the festive season of Ramadan and Ugadi. Best wishes to all. Thank you.